Hello, SAP. I'm Dr. Zoe Rossnash, the editor for the Division 29 electronic content, and here we have Dr. John Norcross with us. I'm very excited, as you were a previous president of the division, correct?
Right.
It is lovely to have you here with our SAP Who's Who. So why don't we get started? Our first question is, can you tell me a little bit about your educational background and professional experience?
Well, educationally, I'm a proud graduate of Rutgers University, where I was a first-gen college student, and I was expertly mentored in clinical psychology and psychotherapy integration by a bunch of wonderful people. That would include Dr. Michael Wogan, Andy Bondi, Winnie Lenoir, and the late and great Arnie Lazarus. I then proceeded to PhD studies in clinical psychology at the University of Rhode Island, where my major professor was the late Dr. Jim Prochaska, and hence we were immersed in the stages of change in the trans-theoretical model. Finished that formal education off with an internship and residency at Brown School of Medicine.
That's fantastic. Are you from New Jersey?
I am, Southern New Jersey in particular, where all three of my sibs still reside. I'm just 3 hours up by car up in the Pocono Mountains.
Very cool. I'm from Bergen County, so very, very proud of New Jersey.
Yes.
Okay, my next
Oh,
question.
so professional experience. Well, then I immediately came here to the University of Scranton, where now I'm distinguished professor of psychology and an occasional chair of the department. I'm also clinical professor of psychiatry at a couple medical schools, prominently including SUNY Upstate Medical University. And then for 35 years, I was a clinical psychologist in part-time independent practice, averaging 10 or 12 hours a week. I somewhat reluctantly gave that up a few years ago, just to make my life a little more livable. And now I dedicate those hours more to supervision and consultation.
Wonderful. Sounds like you wear a lot of hats. Yes. So my next question is, what even inspired you to become a psychologist?
Well, that's certainly a confluence of factors, some conscious and certainly some unconscious factors that are only revealed to you later in your career. Certainly, I'm fascinated with human behavior. There's an ardent desire to help our fellow humans. And that desire, by the way, was cultivated by my parents, both who were in social service positions. There's the quest for self-understanding and self-improvement. I actually spent considerable time trying to figure out which mental health career would be best for me, considering psychiatry and psychology in the end. But in the end, clinical psychology was the perfect fit, as it helps me integrate research, teaching, and practice.
Wonderful. Very cool. Sounds like you've had such a full career. So I imagine this next question about misconceptions in the field, what ones would you say that you encounter?
Oh, so many, Zoe. So many. Let's see. On the top of my list, the myth that clinical experience alone brings expertise or better outcomes. It obviously does not. That successful psychotherapy depends alone on either the relationship or method. Obviously, it should be both. And one of my favorites is a misconception that the plural of anecdote is called research evidence. That one just hurts, but I encounter that repeatedly. In addition, there are lengthy lists of discredited assessments and treatments that are still practiced. According to several studies that Jerry Kuchar and I have conducted, we fondly call that psychoquackery. So there's just a lot of nonsense out there. And, you know, it wouldn't bother me as much if people were not hurting because of the myths.
I have so many questions that I want to ask about that, but maybe off camera. My next question is, what has been just the most rewarding part of your work so far?
So many things have proved rewarding. Let's see, we have working with students, contributing to patients' growth, serving that common good. Most recently, I've noted how grateful I am for collaborating with a bunch of absolutely wonderful psychotherapy researchers. It would take us an hour to name all the people I've been blessed to work with, but just to name a couple this past week, Clara Hill, also a former SAP president, Marv Goldfried, also a former president, Mick Cooper from London. It's been an incredible journey. And I know for some people it might seem a little overwhelming to try to fit in some of these APA contributions, but to me, it just sort of fits into the whole integrative scheme of things.
Yeah, that makes sense. So in your career, what would you say has just been the most unexpected part?
The variety of research pursuits since I obtained my doctorate. Coming out of doctoral work, I incorrectly assumed I would probably be researching psychotherapy integration and the stages of change for the rest of my life. To be sure, I've done a fair amount of work in those areas, but it's just been incredibly varied. You know, Paul Meehl repeatedly observed that serendipity has an underestimated impact on our life. And that's certainly been the case for my career. So this year, for example, we'll be publishing the 12th edition of our Getting Into Graduate School book, The Insider's Guide to Clinical and Counseling Psychology Programs, which I would have never imagined. We just published the 10th edition of our Systems of Psychotherapy textbook, Guides to Self-Help Resources in Mental Health, books on the personal therapy of the therapist, psychotherapist self-care, clinical supervision, our books on psychotherapy relationships that work, personalizing treatment. On top of that, we published a couple of, fortunately, well-selling self-help books, Changing for Good and Changeology. So that was totally unexpected, but entirely wonderful to have such a diverse interest in my research career.
Oh, congratulations on all of that. That is remarkable. Very cool. I mean, I've only been licensed for 2 years, so it's really awesome to see people like you just doing incredible things for our field.
Thank you. Well, I really am grateful to all the colleagues who've permitted me to do that and to be in a university setting which enriches that integration.
So what are your hopes for the field of psychotherapy?
Well, that's an easy one. Integration immediately comes to mind. And when I say integration, I mean the integration of diverse theoretical orientations, as in psychotherapy integration, the integration of research into practice, and I always hasten to say meaningful research, the integration of greater diversity into all of psychology. One of my favorite quotes is from Sir Isaac Newton, who lamented that we're always building too many walls and not enough bridges. My abiding hope is that in the future, we build more connections, more bridges throughout psychology. Another hope, and this is sort of a more negative one, is that psychology does not deteriorate into a generic master's level psychotherapy profession. This has begun to trouble me and lots of my seasoned colleagues, that we see our colleagues simply telling people they're therapists, when in fact they're psychologists. As most people know, virtually no states even license the term psychotherapist. So my hope is that we get back on track, leverage and advertise all that doctoral level psychologists do: assessment, consultation, training, supervision, and of course our multiple specialties, health psych, child clinical, neuropsych. Clinical psychologists are far more than generic psychotherapists. Now, in truth, Zoe, some people are going to say, wait a minute, John Norcross, he's a psychotherapy researcher. Yes, but I'm also a clinical psychologist who does more than psychotherapy. So I'll just throw that in as a second hope.
Yeah, we can do so much with being a clinical psychologist. I appreciate you naming all of that. And I had no idea that the term psychotherapist was not licensed in many states. Wow, that mind boggled me a little bit. So important. What about your future plans?
Well, probably more of the same until I move to partial retirement in 4 or 5 years. I remain under contract to my university, under contract to a few publishers for newer editions of books. But let's see, more travel, more golf, more grandchildren, if my son and his wife are listening. It's time to step up, as has my daughter, I might add. In any case, I really do enjoy what I do too much to ever permanently retire. So I'll probably just go into partial retirement and enjoy that as well.
Right. Well, wishing your children best of luck with that endeavor.
Thank you.
Do you have any grandchildren now?
I do. I have 2.
Oh,
And I'm blessed that they live locally, so get to see them regularly.
that's great.
My son is living in upstate New York in Saratoga. And he asked what I might want for Father's Day. And I said, it's time here. And I promised I wouldn't pressure him. He, of course, reminded me of that promise. I said, yeah, I'm reneging on that promise. It's time. By the way, my daughter-in-law's parents are even more relentless than me. I just mentioned this casually and now publicly, maybe once a year.
Got it. And yeah, now on YouTube forever.
Yes.
That's great. Well, you've already mentioned some of your role within in SAP. I would love to hear about all of your involvement, though.
Well, I've been blessed to be involved in multiple positions and roles in APA's Division of Psychotherapy, or SAP, over the years. And honestly, that's probably because I was mentored by a couple of APA presidents, Jerry Kuchar and Bob Resnick, and also Wonder Woman Linda Campbell. Let's see, in Division 29, I chaired the Education and Training Committee. I chaired the Fellows Committee, the Publication Board. I then served on the Board of Directors, and as you mentioned, then as president, which is actually a 3-year gig, president-elect, president, past president. I also thoroughly enjoyed my 4 terms representing SAP on APA's Council of Representatives. And while I'm at it, if you'll just permit me a moment of privilege, as they say in the political world, I would just like to note that APA's Division of Psychotherapy was instrumental in initiating and shaping many practice and research initiatives for APA that honestly may not have materialized if not for the Division of Psychotherapy. So a couple quick examples. With long-term APA publisher Gary Vandenbos and the late Don Friedheim, we initiated the APA Psychotherapy series, for example. That's now up to more than 400 psychotherapy videotapes that people can watch for training purposes. We also did the History of Psychotherapy book. We did the Psychotherapy Relationships That Work. That comes directly out of Division of Psychotherapy as one of my presidential initiatives. And that, of course, has been edited with Bruce Wampald and Mike Lambert. So Division 29 has done a lot, not only for fellow psychologists practicing psychotherapy, but for APA. I'm very proud of that. I'm delighted with my long-term association with SAP.
Yeah, it seems like you've been in it for life. That's incredible. Well, thank you again for joining us and taking the time out of your day. Is there anything else you'd like to add?
No, other than thanking you for initiating these delightful conversations. I've already watched a couple online. I'll look forward to mine. So thanks for the invite.
Of course, selfishly, I've loved these. They're so much fun, and I get to talk with incredible people. But yes, this will be featured in August, and if anyone is interested in being featured, like Dr. Norcross is, we'd love to have you on. Have a great rest of your day.
Thanks again.
Take care.